biggest problem that my membership had, the group that I worked with, these are smartest, deepest pocketed companies in the country paying billions of dollars annually on healthcare, and they were primarily owning the risk of their employees. But employees, their problem was that individuals were they didn't have the tools or the ways to make smarter health decisions. Because that utilization was skyrocketing and costs were continuing to increase at double-digit rates. It was a personal experience at that time that drove this point home. My wife, Lindsey, you were talking about your child. My wife was pregnant with our first daughter at that time, and we had one of the test results during the pregnancy. I don't know how many of you have kids, but there are a number of tests, and one of the tests came back as being a false positive for something more severe and extreme. And so this got us thinking about how do you make a decision? What is the right decision for us? My wife, like me, is a PhD in economics as well, and she's faculty, much smarter than me and much more rational in decision. And we really try to weigh all our choices, look at all the data. But this was one of the hardest decisions we had to make. We were sitting in Washington, D.C., with some of the best doctors in the world, with the best network, with the best access, but really found it hard to reach a conclusion. It was not about the information. There was tons of information. There was just way too much, actually. It was not about the right doctors or the tools, the resources available. It was getting that confidence, that peace of mind with your choice. It was a personal choice. Because regardless what you do, you have to live with it. And that was hard. And you speak to counselors, you speak to genetic counselors. That time was a genetic test that we were evaluating. And nobody gave you that same peace of mind. And it was not just the information they provided was not presented in the right way. It was the data that was not presented in the right way. It was the information that was not packaged in the right way that was right for me. Because as we were in our early 30s at that time, with a certain income level, with no kids, no religious sort of constraints. So we're pretty open with our choices, but it was not packaged in the way that we needed to make a decision. And that got me thinking. It was my day job was helping employers make better decisions, helping employers introduce health plans that help their employees make better decisions. But at night at our dining table, we struggled with making that decision. And that was a mismatch. And the bet that we took was with the right data, with technology that was being introduced, and information packaged in the right way, can you come up with a better choice and a better tool? And that's what WiserTogether does. We help people make better health decisions by personalizing the information, curated information in a way that is actionable for them.
Things are iterating very quickly, and I can't tell right now, because I don't think I have enough perspective, if it's iterating quickly because of the role that I'm in specifically, or if it's the industry as well. I think that it's the industry as well. I think that if you're less involved with the government, it moves faster. If you are more involved with government regulations, you tend to just wish that it would move faster. And so it seems like one of the things that's been important for us is adopting very quickly and still narrowing down, being very driven to what's the end goal and what are you trying to take away from this, and what's your key objective.
Typically, when we're thinking about how we're going to solve for an issue, we have, I work for a very large organization of 145,000 employees that is international, right? There are lots of people. It's hard to connect to all of them and everything that they do. But one of the things that has been really permeating the organization from our CEO on down is the idea that human-centered design really needs to be very centric to all of our solutioning, because otherwise we try to solve inside out instead of outside in. And when we think about human-centered design, it isn't just about solving for the individual consumer, it's about solving for all of the constituencies that we serve. We have lots of contractual relationships with providers, we work with government, we work with lots of employers, consultants, brokers, all of those entities. So how is it that we take the perspective of the individual, walk in their shoes, kind of like what Shub was talking about, and really apply it to the products and the services and the tools and capabilities that we're building? And it's really a force of nature in terms of how that's sweeping through our organization, making sure that that is a consistent part of our design effort.
Individuals have a list of factors that matter to them. In fact, there are 22 elements that really matter. And they break down into 3 buckets, really. Does this treatment work medically? What's the evidence for it? There are essentially 6 elements around that. Does it work financially? What's the coverage? What's the cost? There's a lot of cost transparency buzz right now. That's important, but it's just one of the 22 elements. The third piece, which is the biggest, half of the 22, is does it work for me personally? Things like how difficult is the treatment, side effects, speed to recovery, pain, personal elements that only you know. And your doctor may know if they know you well, but not everybody does. And the health ecosystem doesn't know at all. Imagine if you capture that information systematically, so you don't have to input it every time or share it with the doctor in every interaction, or a nurse or a navigator every time you interact with the healthcare system. Capture that systematically and put it in the information, the EHRs, the payer systems, the provider systems, that they can use it. This is that last mile that is missing, so they can then personalize healthcare. One of your questions is, where's healthcare going? I think the next wave is around personalization. EHR was just the first step.
How you get closer to entrepreneurs. As such a big organization, you're in some ways in conflict with the athenahealths of the world, because they potentially can be more nimble and more receptive to supporting becoming a customer of an entrepreneur earlier than UnitedHealth Group can. So I'm curious about how you see that, your relationship with entrepreneurs, whether or not UnitedHealth Group is just higher up in the food chain, or if you are making efforts to support entrepreneurs on an individual basis, and what that looks like within your organization.
Sure, absolutely. Thank you for the question. So that happens in a variety of ways. So much like I talked about the cell phone, right? It's, you think of everybody behind it. So for example, we rolled out a bill pay capability. We're the only insurer that has that. So when you have a claim, that you know exactly what you owe. And the company who actually does all the work on the back end with regards to having all those payments happen is Instamed. We didn't try to build that. There's no way that we would, believe me, financial regulation is almost worse than insurance regulation, especially from an online perspective. You don't really, so we worked with them. They're a very entrepreneurial organization that has a lot of capability that they've built. And so all of our solutions, you may not see them, but they're really powered by others as well, because we understand the value of that adjacency. More directly, though, we have a ventures group that actually hunts out startups with regards to actually being able to finance them. So think of kind of a venture board, very much alive and well. We have an entrepreneur in residence program where we had 17 ideas go through that last year, and 3 have been actually financed to move forward. We have an enterprise-wide innovation council that actually brings a lot of our senior leadership, where all walks of life within our organization have an opportunity to bring forth an idea. So for example, we have somebody who's a claims adjuster who had a really cool idea that we financed kind of in that let 1,000 flowers bloom with a little bit of money, a little bit of seed money, so that they can, and we give them a lot of support from a human-centered design perspective, from an operations perspective, because they're out of their complete, like a fish out of water with regards to what they're trying to do. And then they also have the intimidating factor of having to present and pitch that idea to senior people that they many times have never actually had an interaction with. And then we fund Rock Health.
I'm Brian Flaherty. I'm also a Tux student. I've heard a lot of different problems that seem very interesting that you guys are working on. You talk a lot about making healthcare more personal. You talk about facilitating the administration of a physician office. You talk about helping large payers manage their healthcare costs. What other problems are out there, and which ones do you think are the most exciting to be solving in the healthcare space today?
We're doing a lot of work with patient collaboration. So how are providers communicating with patients and enriching that experience and empowering patients to own part of the decision process themselves? I know that this would resonate with a lot of people here, but there's a lot of creative ways to go about that to crack that nut. And so there's some companies that are doing interesting work related to that.
Shub, how about you?
Yeah, I was going to actually go with the patient side. I think that's one area which is completely untapped right now, or it's emerging. It's the opportunity about looking at it from a patient perspective, and patients are not the same. Every patient is not the same. Understanding their situation and helping them, the patient-provider relationship, the patient-payer relationship, and the other ecosystem in the healthcare world is still catching up. You look at consumer products, you look at consumer solutions, the level and understanding of the patient and the service component of it is light and day different from where healthcare is. And the legislation is here has opened the gates a little bit, but that flood is coming. And I think there's a huge amount of opportunity for it. The other thing that it also does, I think, if you look at the business structure, previously, healthcare is expensive. If you want to innovate in healthcare, it takes a lot of capital, it takes a lot of time. It's a slow-moving industry, or at least historically it was. But now with the focus, with sort of the new incentive structure, the new players in the ecosystem, providers and payers are taking a step back and really thinking through from the patient side. You'll have CEO access. Yasmine was talking about how you can get to different levels. Jonathan Bush is actually quite a proponent for it. He will see, and at the More Disruption Please conference, he's there, and he's there with their team. You get access to pretty much that CXO level right now, because the patient is, if you have a patient solution, because that is so critical to the business. I think you're just scratching the surface of what you can do from a patient perspective and patient experience in healthcare.
We talk about data and how much we have, and okay, don't ever repeat that I said this, but who cares? Because if it doesn't actually turn into information that is utilitarian to anyone, what difference does it make that you have, this much data? So I think that whole scenario that I was talking about with regards to your cell phone and how much data, new data there is very real. And the truth is that how is it really actually being used? And where does it go? And who owns it? And where does it reside? And so I actually think that data integration and data aggregation is really going to unlock a whole lot of incredible information for us. But I don't think we're quite there yet, right? And I think that when we're solving, and I see and I'm excited by all of the solution architects that there are out there, the thing that worries me is how much more it fragments the healthcare delivery system, because it is pretty fragmented today. We have so many things. So for example, guys, we have no open table for appointment scheduling in the provider system, right? There is no one. We have DocZoc, and we're, or ZocDoc, I can't remember. Yeah, ZocDoc. And we're experimenting around that as well. We have 3 pilots working on that right now. But really, we don't have one platform. And you know why? Because there is no one single appointment scheduling system within practices either that can feed you that information. So we have data integration. That, to me, there is a secret sauce in there. There is an incredible opportunity around that we have just not been able to really crack that nut yet.
Okay. Good.
Brett Anderson, I'm a second year here at Tuck, and in follow-up to what you guys had just said about fostering better patient engagement, can you talk about how your technologies at each of your companies have been able to do that, especially communicating between the patient and the provider, and then between providers? It seems as though, we're overrun with technology, and you have like an EMR into the patient, exam room now, and now doctors are just typing their notes, not even facing the patient. I wonder, Shub, is your technology just going to have the patient focus on their own application just as much as the doctor will? And how do you kind of foster more of that communication between the patient and the physician? And then, Yaz and Lindsey, are you guys looking also at better communication between the doctors? You'd mentioned, Yaz, how fragmented the care is. And obviously more collaboration needs to happen, and possibly technology is a way to facilitate that.
So if you take the experience as a whole, the entire experience as what you need to focus on. And when you talk about patient engagement, the reason they talk about just patient engagement is because that's missing right now in the system, and that's how you focus on. The key is shared decision making. Individuals by themselves are not capable or should be making decisions. It has to be shared within the context of the payer and the provider. And companies that would be successful down the road has to be around the doctor and or the medical professional and the patient interaction. Once you get that right, or as you're getting that right, it has to then be coordinated within the healthcare ecosystem, and having systems where personal health records or EHRs are one way to have that coordinated care, that collaborative care, and think of it as it's shared decision making with a group of doctors, a group of providers, and that's where it comes in, and that's what the focus needs to be. You're absolutely right. It's not just done in isolation or in absent of the other parties in the system.
I don't think, I think to Lindsay's point earlier, there's no silver bullet around this at this point, right? But, so here's some of what we do, right? When we know a patient needs to have a refill on their prescription, we're sending them a message, we're sending the doctor a message, right? So we're trying to make sure that this is awareness that we're consistently creating. When they don't fill the prescription, we're sending the doctor a message, letting him know that. And we're trying to, really integrate with all the systems that are out there, not easy, at the symposium, we talked a little bit about that, not an easy thing necessarily to do. But we're really trying to engage our members on an ongoing basis with regards to kind of their health, and then also make sure that the physician knows the things that we're doing as well, just so that, one, it's not redundant, and two, so that they are aware and can then kind of, initiate it. The problem is that there is, we don't all do it the same. They have to deal with all the different payers in this regard, and then they have probably not enough time to take a look at all of that information that we're actually sending them. So think about the fact that we would like to be able to send them, blood pressure readings that we know we can get from if they give us permission, but doctors don't have a way of incorporating or integrating that into their chart or medical record for them to really see it, right? Now the other thing that we did with our mobile app is we created the PHR is mobile, so they can go to the doctor's office, let's say they're seeing a new doctor, and they can say, my last cholesterol level was X, my last BP was X, so that there's a lot of that there. But think about the fact that every time that you go to a new doctor, you have to fill out that medical history form all over again, and that we have no one single repository for that actually allows you to be able to provide it and give it to the new PCP that you have, right? We can't. So there's a lot for us to still work on, and I think a lot of us are working on that, and some of us are working on it together, several of organizations together. Because otherwise I don't think we're going to get far enough, fast enough, so.
Thank you all very much. Thanks to the three of you. It is always a trek to get up here. We appreciate that you took the time and that you've taken time with students today, and we appreciate it. Thanks to the panel.